morning, YouTube. We're back here in South Florida, down. It's a beautiful day, isn't it? Check it out. It's not bad. It rains a little bit, but it's pretty good. Yeah, that was like a stalling technique because I just forgot what to say, but we're gonna roll with it anyways. I'm here at APMR, Miami, my favorite therapy place, Advanced Physicians. I know you guys don't know, but now you are gonna know. I've been dealing with an injury on my right shoulder for the last 4 or 5 months. I have 3 partial tears, iphius spinatus, subscap, and my labrum. I also had a strain in my trap from benching. The powerlifting world is how it works, okay? I didn't get hurt doing anything crazy, I just got hurt benching heavier weights, right? It's okay, dealing with it, but I did deal with pain for the last 4 or 5 months. I had PRP, I did PRP, and I did A2M, and today I'm adding another pair of injections that are a proprietary blend to better, how can I say, make the PRP and A2M work better, right? On top of the Prolozone shots that I take on a regular basis. Finally, after the PRP and A2M, my shoulder is back up to probably 90%, where I could do everything. And I'm just doing this proprietary blend to make sure that it's good to go. I'm also gonna do it on my other shoulder. But I also have arthritis in my rotator cuff, my right one, so I'm pretty sure I have it in my left. So today we're gonna break down exactly what PRP is, what A2M is, and how it helps the body. Anybody that's injured and you're not completely screwed over, meaning like you don't have a full tear, like if you blow your knee out or you have a full meniscus or a full ACL or a full labrum tear, then most likely you're gonna have to have surgery. But if there are partial tears like mine, or you just have pain because they're strained, I highly recommend these procedures that we're gonna talk about today. So stay tuned. I hope you like this information because for me, it's been probably a game changer in the ability to train for long periods of time like I have for the last 20 years. So for the older guys, this is gonna be a video for you. Stay tuned. All right, guys, so we're here in the office with the man, the myth, the legend, Doc. All right, so I'm not gonna go into his name. You guys already know his name and stuff. This is not his first rodeo with me. So listen, real quick. You guys know that I got hurt. I've been dealing with the shoulder issue probably about 4 or 5 months, okay? So some time ago, I did PRP, all right? And then from the PRP, then I did A2M. And now today, what we're gonna be doing is a proprietary blend that helps the A2M work better. Right now, I'm gonna explain to you what these therapies are, guys. It's important that you know it because if you do get hurt, you can go to a place like this. If you come to Miami, you can come here, or you can go to other places where they can do it for you. And let me tell you, my shoulder is good right now compared to where it was before, where anything that I did hurt. All right, so Doc, first explain to them what exactly PRP is first, the first thing.
So PRP is it's basically when you take blood out and we're harvesting platelets in the blood. So when you do a 15 ml draw of blood, we separate the red blood cells, the white blood cells, and then we have a layer of platelets, platelet poor plasma, platelet rich plasma. When we isolate that plasma and inject it back into the joint, essentially what you're doing is you're taking a bunch of nutrients and growth factors and putting it into an area where there's tissue damage. Those growth factors enable the body to reduce inflammation and potentially help the joint or tendon heal by itself.
Okay.
So there's a big difference though with what we did afterwards, which was A2M. Alpha-2 macroglobulin and PRP are apples and oranges. They're completely different.
Okay.
So the issue that we have with PRP with athletes and people when they get older is that when you have an injury, either inside the joint or to the muscle itself, your body releases enzymes called protease and proteinase. And they're good and bad. Initially, these enzymes are released to help your body break down scar tissue. When your body heals, initially there's tough tissue, connective tissue. Your body releases cells called fibroblasts that help build the repaired tissue in a way that doesn't have as much flexibility as it did before. Once those enzymes are done chewing up that tissue, so to speak, to make it more flexible and elastic, there's a large protein molecule that's found in the blood that attaches to those enzymes to basically deactivate them. The bad thing about those enzymes is that if they remain active in the tissue site or in the blood for a long period of time without the A2M to attach to them, they can actually cause damage. So when you look at rheumatoid arthritis patients or osteoarthritis patients, they have a high expression of these destructive enzymes in the tissue itself, primarily also within the joint. So what we did with you is there's a process, there's some kits. We use a company called Regenerative Kits, and they send us these kits that we're able to take out blood. We filter out all the platelets, and we're able to isolate A2M and also filter out all of those bad enzymes that are found in the blood. So once we take those A2M molecules, those alpha-2 macroglobulin molecules, and we inject it into the tendon that's injured or into the joint that is arthritic or damaged, your body then has the potential to reduce inflammation significantly and also to begin the healing process. So for people who have done PRP and it hasn't worked, this is completely different. This is a game changer. This is something that, along with a proprietary blend that we use here in the office, both before and after the A2M procedure, we've had, like you mentioned before, just to give you an example, I don't know how much you've gone into the injury, but you had some injuries that weren't going to heal by themselves.
Yeah.
Because of repetitive trauma, because of aging and overuse. Can I tell what we tried? We did Graston technique. We did trigger point injections. We did large joint injections. We adjusted the AC joint, the SC joint, mobilized the shoulder blade. We did cupping, anything you can imagine, ozone injections, and nothing was getting you there. One treatment with the A2M, and when we followed up within 2 to 3 days was
good. Yeah.
And it's getting better and better and better. So if you have these injuries that you've already done some things before, this is definitely something you want to take a look at.
For me, the whole thing where I was trying to do was just I don't want to get surgery. I hate cutting up because once you go in there, you do surgery, there's never any guarantee that it's going to be better. According to the MRI, I already have arthritis in my rotator cuff. So at that point, there's always going to be some form of pain there. Regardless, arthritis is never going to go away. It's there, right? So I said to myself, well, avoid surgery and go this route. And I can tell you it's been great. It's avoiding the surgery and getting cut up and creating more scar tissue and going this route is just helping and stuff. Now, I had partial tears. I had 3 partial tears. I didn't have a full tear. Okay, if you have a full tear, then that's going to be a different animal. You know what I mean? But definitely if you have something where it's a partial or it's a strain or something like that, I highly recommend this stuff. I can tell you from night and day, my shoulders, I don't have any pain whatsoever right now compared to everything that I did. I moved around. So today, we already did the PRP, the A2M. Today, we're doing the proprietary blend to add and help the A2M, correct? That's what it is?
Correct.
Okay, good.
Yeah.
So, check it out.
Well, you said some good things too. The more information is always better. The more diagnostics that you have, once we really got that MRI, and we're able to isolate where the injury is, specifically what it was. That was the big difference.
Yeah, I was being stubborn and not wanting to get the MRI just because I'm an idiot. And finally, when we got it, we saw where it was, and then we were able to inject all the main points of the shoulder that had the issues. So, and then that started helping little by little. Plus, the Prolozone shots always help as well. Mm-hmm. So, if you guys don't know about Prolozone, I've been a huge proponent for it. I think it's great, and it's maintained me for the last couple years in my older age and being able to do all the things that I do. So that's another big one too. So I would say, in the comparison, you have your Prolozone shot would be like the first thing that you do, see if it works. You know what I'm saying? If that doesn't work, then you're gonna go to your PRP. That doesn't work, then you're gonna do the A2M. And if that doesn't work, then at the end of the day, that should have worked. But if it doesn't work, then you try the last proprietary blend. Right, so that would be it. That was my suggestion. Obviously, I'm not a doctor, but at least what it's worked for me, I'm giving you my opinion on what helped me. So now we're gonna pretty much show you what they do and how they inject me and all that good stuff. Stay tuned. guys, so pretty much finished the 2 injections. I got one on the top of my shoulder, one in the back of my rear delt area. Doc, how long should I be without training? What is my rest period for?
10 to 14 days. And we want to really keep the inflammation low so we don't create new injury. The instructions are no anti-inflammatories, Advil, Motrin, or Relieve will inhibit or slow down the body's ability to heal in that area. So you could use ice if you needed, some Tylenol as directed for pain.
Yeah.
But training, 10 to 14 days, take it easy.
Take it easy.
Yeah.
Okay. Where can they find you, Doc? We're
down here.
Social media wise, where you are, all that stuff.
You can find us at APMR Miami on Facebook. APMRmiami.com is our website right down here in Miami.
Okay, and what about Instagram? You guys have Instagram?
Yeah, Instagram is at APMR Miami.
Okay, at APMR, okay.
Yep.
Those links will be in the description. Guys, all those links will be in the description. I highly recommend this facility, man. These people are phenomenal. They treat you like family. I've been coming here for years already, and I wouldn't go anywhere else. So if you're in the Miami area and you need some therapy, whether it's chiropractic, whether it's PRP, whether it's cupping, whether it's whatever, this is a place to go. All right, guys. See you on the next one.